Hello, everyone. Welcome back. Today we have with us Dr. Samidha Fadte, who is a young pediatrician, dynamic IAPN, and who is currently working as a senior resident in Goa. Welcome, Dr. Samidha. Thank you for taking time out to be with us
Thank you
today.
so much, ma'am. Thank you for giving this opportunity, and it's nice to communicate with you online on a video call.
Thank you. We will today take up a few uh, discussion points on child health. So let's start with trying to understand when we have a newborn, what is the timing of the first bath for the newborn?
Ideally, ma'am, since the baby is born, they have this white burning. So, which usually previously people used to vigorously try to remove. But now, because of the recent studies and because of more awareness, it is told that it gets absorbed on its own. So, it's like a protective layer on the skin. So, once that is absorbed, I think normal tepid sponging is enough for the baby. Ideal bathing of the baby should be done once the cord has fallen off. And here I would like to also tell all the parents out there that instead of using that hot water, you should try to use lukewarm water and a Cindet bar soap, which should be better for the skin of the baby.
Okay. Thank you, Dr. Samida, for explaining the use of lukewarm water, not very hot water, and you mentioned about the soap. So you talked about a Cindet soap. Can you explain a little bit more about that? What exactly do we mean by Cindet, and how is it useful for the newborn skin?
So usually, ma'am, they use in a common words to explain to all the audience. Cindet bar is something that has pH closer to the skin, so it does not affect the skin barrier. So it is just good enough to clean if there is. Usually, our skin has got self cleansing mechanisms, but when you use the Cindet bar, the pH is very much good and very comfortable to the skin. So and it doesn't have any harmful side effects like rash or irritation. So it's very softer to the skin, and that's why it is usually preferred other than the cosmetic soap which are available in the market.
Right. So thank you for explaining that. What about oil? Is an oil massage beneficial for the newborn?
So, ma'am, there are two schools of thought. Some people say that we have to use it. Some people say that we may not be using it. But traditionally, they do say that oiling, actually, the massaging, if done properly in a very delicate manner, where it is mainly by a trained professional, or it's very soft, only like affecting the, only trying to turn the joints with minimal flexion extension, then it's definitely good. And coming to the oil, actually locally available, whichever is filtered, can be used. Like as we know in Goa and Karnataka, I think the um, oil which is commonly used is coconut oil. So I think it can be used, but only here we have this thing where people try to make oil at homes with their own coconut. So sometimes that can lead to rash because it is not properly cleaned. The distillation of oil does not happen. So sometimes the coconut particles which remain can actually cause some rash on the skin. So if that is taken care of properly and it is properly distilled at the industrial level, I think coconut oil is good enough for our Indian skin at least for the west zone of the country.
Thank you. Thank you for explaining about the beneficial oil to be used and something which will not irritate the skin. So, as you have mentioned, the well filtered coconut oil will be ideal for the newborn baby's skin. Now, can you also tell us, besides the bath and the oil massage and the soap, any other important points on newborn skin care?
Ma'am, the most important thing I think we always encounter and we want parents to know is that stop touching the eyes of the baby, stop applying kajal to the eyes, and stop putting ear oil or earbuds in the ears. I think this is the most important thing we should be passing on. And also try to wash your hands before handing the babies. Don't allow too many relatives to come and touch the baby because it can definitely lead to some URT, upper respiratory tract infection, a common cold in the babies, and they are too small and they don't have that much of immunity to fight the infections.
Right. So that's, I think, a very important points that you have brought up. Now, let's talk a little bit more about the infant feeding. So before the infant feeding, we try to talk, explain to the parents about the kangaroo mother care. So can you tell us how this is beneficial, and how does it affect the baby's growth and development?
So, ma'am, kangaroo mother care, as it is said, it came from from the concept of kangaroos, how they put their babies in their own skin, and it provides them a better adaptability to the harsh environment. So, it basically came from Australia and New Zealand, and then it was adopted slowly globally all over the world. And now in India, with the NICU and all the preterm babies that are coming up, I think it's one of the most important modality that we have in treatment. So it works where there is a thermoneutral environment that is provided to the baby, and it also improves their immunity. It improves the quality of mother's milk. It helps with their bonding. So I think this maternal and child bonding is extremely important for the further growth and development of the baby, and later on also for to avoid any stress, maternal exhaustion, because in neonatal ICUs or even when the babies are admitted, it's very stressful. And this is usually done for babies who are less than 2 kgs or who are preterm. So giving this kangaroo mother care, I think it's very important and beneficial part of the NICU, especially in the treatment of these babies. And now because of the kangaroo mother care, there is kangaroo father care also, where other than the mother, where the mother is given rest and other family members can also participate in it. So it's something very useful, and it's very nice where we are trying to use the nature's concept in treating the preterms.
Very nicely explained, Dr. Samida. I think the KMC, as we call it, the kangaroo mother care or the kangaroo father care, do go a long way in the neurodevelopment also of the infant. So I think that's something which is really ideal, and something which is excellent for the newborns. Now, the feeding sessions, a lot of mothers have this doubt about the duration. How long does each mother's milk feed need to be lasting, ideally?
So ideally, one session should be from one side of the breast. It should be lasting for at least 15 to 20 minutes, because the previous 5 to 10 minutes, as we know, is only the fore milk, and which is only for the thirst of the baby. And later on, the milk which comes after the 10 minutes is actually the hind milk, which is rich in carbohydrates and fats and lipids, which is actually extremely important for the development of the baby. So that's why we tell that the session of breastfeeding should be at least for 15 to 20 minutes, and from one side of the breast. There should not be breast switching. When mothers feel that, okay, now I feel I'm getting less milk, so let me change the side. So it should not be done. So that is what we should emphasize on.
Thank you. Thank you for explaining this very important question, which a lot of the mothers, especially the first time, the primary mothers, have. So, Dr. Samida, you have given such clear and crisp answers to all the questions. Well, I'm sure we are definitely going to have some more sessions to discuss and take this further. Now, I have one question for you. You are a young IIPN, a dynamic young lady, and you are a leader. You are the secretary of your Goa State branch. So I want to ask you this question: how has your journey so far been at IAP, and how has IAP helped you?
I'm truly grateful, ma'am, for receiving this opportunity to be IIP secretary for Goa, because when I took it, I was very stressed at how I'll be managing it, especially with the work and all. But I think somehow, if you are meant to, then somehow uh, everything gets managed very well. And I'm looking at this experience more like a learning experience, because it has given me a lot of scope and also to understand various things. And it really helped me in networking, meeting really great teachers. And when we organize these modules, we come in contact with pediatricians from other states. Otherwise, it's very difficult to communicate with other people and find doctors from same branches. And since Goa is a very small state, we don't have that much of exposure in Goa. So because of IIP, I have really got a lot of opportunities actually to communicate, and I have actually, I think the managerial skills have become good. It's like organizing this module, that module at the end of the time, and organizational skills have improved. So it has really helped me in building a foundation, and it has really aided my growth. And the experience has been wonderful. And this past 1 year, over the past 1 year since I've been serving my term, it has been an amazing experience where every month there is something new to learn. So, and definitely, ma'am, one of the thing I also came in contact with you because of IIP. So yes, it's been a very nice experience.
Right. It's so nice hearing, these words from you in terms of how you have learned networking, how you have, developed your skills, organizational skills. I think as a young leader, what you say will definitely carry a lot of weight for the other young IAPians. So thank you, Dr. Samidha, for sharing this, your as you mentioned, it's 1 year, so it's a relatively brief period. But as you have mentioned, yes, you have learned a lot. So I think that's hats off also to your commitment and the zeal that you have. I can see that coming out of you. The desire to learn, the desire to have more skills, and as you rightly mentioned, IAP is giving you the opportunities. So I think we are all part of this big IAP family, and I'm so happy to hear these words from you, Dr. Samidha.
Thank you, ma'am. Thank you so much. Ma'am, if you don't mind, I really was very curious to know how have your journey in pediatrics has been, because you have really a vast experience, and it's very nice to meet you and network with you. So, ma'am, how has your experience been? If you have any tips for us, like what are the things we should look out for? Because I feel when the pediatrics you started way back then was usually limited to textbooks and all about clinics. Now there is more and more AI coming. Especially, I have seen residents using AI for interpretation of growth chart and all. So, ma'am, how has your experience been over the years?
Yes, Samidha, this is, I think, a very, very relevant question to the current times. So I have 36 years of experience, clinical experience. So well, yes, it's been a long time since I graduated. And as you rightly mentioned, in our times, even to get hold of journals, up to date journals, was a task. I graduated from the Government Medical College, both my undergraduate and postgraduate education from the Government College in Bangalore. And it was always a challenge to be able to get the required journals, the required textbooks, etc. So we had to visit multiple colleges, and at that time we had just another one or two colleges around in Bangalore. And yes, so our networking skills actually began right at that time, because unless you have a contact there, you cannot enter the other any other library. So we started out that way, and there was a lot of hands-on learning, if I may tell you, wherein we were spending a lot of time way beyond our prescribed time in the wards, examining the patients, doing the bedside investigations. We had a little lab attached to every ward, and then we would, pick samples, run there, look at the stool, look at the urine, do a finger prick, and look at the blood. So it was all done by ourselves. And then when we needed to do any other major, investigations, for us, major at that time was chest X-rays. Then, of course, ultrasound started. So we used to take the patients personally into those particular departments, accompany them, stand with the patient when the procedure was done, so that we could see and learn from those specialists. So that's the way I started out. We did have a lot of dedicated seniors, teachers who would guide us. And I think the time that we spent in the wards was actually what shaped us. So it was only subsequently that, well, we had access to CT scans, MRIs, and all that came much later. So we learned to rely on our own skills. And that is, as you have mentioned, touching the patient, auscultation, percussion, palpation. So all those, basic steps of clinical medicine is what we really applied and developed our skills. So it is, I think, and then we used to read, and a lot of learning happened on with discussions. So discussions amongst the peer group, discussions amongst our colleagues. Sometimes we used to have discussions with those from the other colleges. They used to come into our college, and we used to have joint sessions. So that was the way we learned and shared knowledge. Of course, AI has changed a lot of the learning skills these days, and we have to keep up with the times. So I think it's now probably a phase of unlearning and relearning that we seniors need to do. But well, yes, this has been my journey. So I have seen, it evolving over the years. I think what remains steadfast is patient care. So I think that is something which never changes, come what may. So I think basically that is the ethos of pediatrics.
Yeah, ma'am, because 36 years is like, ma'am, 4 decades of pediatrics.
Yes,
So
it's
how it has changed from the first decade till now, I think you must have seen like seeing all the history of pediatrics. So it's very nice to know about all these things. And I think I fell somewhere in the middle where I think clinics are still there, but
yes,
yes, the use of technology has been increased
right,
a lot. And one good
right.
thing, we are very fortunate enough that we can just Google any journal and we get so much of information. We don't
True,
have to go
true,
to library now to do
true.
things.
True. It all seems passe. What we did in the past all seems passe. Run around, look for books, request our colleagues, can you get me this? And then, take printouts and, sorry, Xerox. There were no printouts as yet at that time. So, well, that's the way we have, learned and grown. But, well, it's also nice to see that everything is at, the fingertips, the press of a button, and you have the whole information explosion literally. Well, that is also a very nice way, and probably a faster way of learning. But thank you so much, Dr. Samidha. It's been really a pleasure talking to you, and thanks you once again for taking time out to be with us today, and looking forward to having more such sessions with you. Thank you so much.
Thank you, ma'am. It was nice, and thank you for this opportunity. See you soon.
Thank you. Thank you, Samidha. Thank you.